Welcome to the Dr. Doug Show, where I bring together two critical components of self-mastery, HealthSpan, and mindset. The topics I present here will help you to improve both your body and your mind and help you to live better, longer. So today I'm actually going to take it back to basics. I should have done this early on, but I want to talk about our pyramid of optimization. This is the framework that we use in both our health optimization side and also our bone health side to help to create custom programs for people. And I want to walk through this because I think it's such a great framework to consider whether or not you're working with us, doing something on your own, or working with another provider. Because let's face it, there are a lot of integrative and great functional medicine providers out there that are helping people. But what I find is that even the best providers can get so stuck in their niche that it's hard to look at it from a big picture perspective. So I'm going to go through this with you today, give you this framework to consider, and it'll help you on your own path on optimizing your health. I'll see you in a minute.
3, 2, 1. Here we go.
Okay, so if you haven't heard me go through this before, take a look at this picture. This is our health optimization pyramid. This is what we've updated over the last several years as a framework for us to create these custom programs for people. And what you'll find in here is that there's just different layers. In each of the layers, we have supplementation, we have hormones, we have peptides, there's drugs. All of these things have a role. I think supplements are important no matter what diet you're eating. I think hormones can be valuable to either optimize or potentially replace, depending on the risk-benefit conversation. But none of those things individually will have enough power as all of them put together into a program. On top of that, we have to consider all of the things that are in the base layer of this pyramid. So let's start there. The pillars of health. We used to have 4. We've opened it up to 6, and I'm going to talk about why. But there's 6 pillars of health that if you're not focusing on these things, there's not a supplement, a hormone, a peptide, or a drug that will help you to optimize your health alone. We have to build the foundation before we build up the rest of the pyramid. So I hope that makes sense. So if you look at these pillars of health, we have kind of the most common 3 that you hear everywhere listed on the left: nutrition, exercise, and sleep. I'm going to address them independently. So from a nutrition perspective, if you don't have good nutrition, again, none of the other stuff matters. You have to get the right building blocks. And I'm not dogmatic about nutrition. I might sound that way because I have some very specific and biased opinions about nutrition, but you can eat a lot of different types of diet. You can eat extremely variable input of food, whether it be whole food, plant-based, carnivore, omnivore, Mediterranean, paleo. It doesn't matter. There's so many ways that you can do this, but you have to make sure that you're getting the right nutrients. You have to make sure you're getting enough protein and enough calories to help you achieve your goals. So that's why our dietitians and coaches are open-minded enough to help people to do what they want to do, but help to guide them so that they make sure that they're getting all the things that they need. So my preference personally, and what I recommend for my patients if they don't have a preference, is to eat a protein forward with adequate protein, around 1 gram per pound, from animal products, mostly diet, that is focused simply on that. And if you focus on the protein part, you really don't have to worry as much about the rest of it because you'll be so full that there really isn't that much room for anything else. I recommend people then add in the other things with specific vegetables that they can tolerate, starchy vegetables, again, that they can tolerate for carbohydrate intake, and then adding fruit for sweetness and variety and vitamin C, etc. And that's kind of the foundation. Now, people will then ask, well, what about grains? What about nuts? What about this? What about that? All of those things could potentially be incorporated. It just depends on your personal tolerance, your metabolic capacity, and where those things are coming from. So that's where we have to get very specific, and it becomes very customized. I don't believe that there is one diet that is right for everyone. I think we really need to customize the nutritional approach based off of our history, our family, our needs, our budget. There's so many factors. So I think that we can really help people to do a lot of different things. So then the next one is exercise. Now, exercise is something that I used to do a lot of different things. So I used to ride bikes a lot. I still ride bikes, but not necessarily as exercise, more as recreation. So I used to ride bikes. I used to compete. I used to avoid resistance training because I didn't really enjoy it, and I didn't want to get heavy. And I have the blessed capacity to put on muscle mass, which is great. I love that now, but I didn't like it then. So I used to eat a relatively restricted diet, do a lot of chronic cardio, ride bikes, train hard. I was really fast on a bike, but I was not very strong and I was not very healthy. What I've learned in the HealthSpan space and helping patients, particularly bone health, but also now in more HealthSpan and longevity, is that resistance training is king. We need to protect and optimize our muscle mass as we age. The most important way to do that is through resistance training. And this is really true for women. It's a little bit easier for men. It's important for all of us, but women really need to focus on resistance training. And I hear all the time, but I don't want to get big. And I challenge you, show me that you can get too big doing resistance training. Send me before and after pictures. I would love to see it. I've only seen it one time. I've had one woman who trained really hard and she got some pretty big deltoids. I think she looked great. She thought she looked pretty muscular. But anyway, it is really hard to do for a lot of reasons. But really, you need the resistance to improve muscle mass. That's going to help you with every other aspect of your health. So resistance training is king. Aerobic training has value, but chronic cardio, which so many people do, is inflammatory and it will work against most of your goals. So resistance training king, and then adding in the other things that you want. Could be yoga, could be Pilates, it could be a lot of things. And again, this is the customization, but exercise has to be a part of every day. You have to understand what you're training for. Is it a rest day? Is it a resistance day? Is it a VO2 max day? Is it an interval day? Whatever, it's got to be part of your day from a health optimization perspective. The third pillar is sleep. So sleep is really critical. Again, just like the other three, if you're not getting sleep, none of the rest of the stuff matters. You have to sleep to recover. You have to sleep to have good brain function. You have to sleep to feel good, to look good, to optimize your health span. You've got to sleep. That's likely an 8-hour window, at least 7 hours of actual sleep. I recommend that people track it. You can either use like a Garmin watch or an Apple Watch. The Oura Ring is great. There's a new ring, I can't remember the name off the top of my head, that is coming out at the time of this recording, which looks pretty cool, specific for women, tracks cycle too, which is neat. A lot of different ways to do it, but I recommend that you track sleep, make sure you're getting good sleep, getting good quality sleep. There are a lot of tricks and hacks around sleep hygiene and ways you can improve sleep, but ultimately sleep is critical. We have to get good sleep. Social connection. So this used to be, these last three, social connection, mindset, and spiritual health, used to all be kind of lumped into stress mitigation. So we had 4 pillars, now we have 6. The reason why I separated them out is that they are separate things. Social connection is really important, as we learned around the pandemic. So this is, Optimal Human Health is a pandemic company. We started in 2020. And so I watched as people struggled with social disconnection. And a lot of people still are disconnected because of the changes in their life and their work. People that work from home, like myself, we are disconnected. And we have to be very intentional about making sure that we're nurturing our inner circle, nurturing our friends, nurturing our family, understanding that it is critical to maintain that circle and the people around you so that you can continue to learn, to get out of our social media created niche, because these companies are working to kind of put us into our own little box. And the more we search and see the same things, the more it just drives the same thing down, so that you don't see anything outside of what is just immediately around you. And you really have to focus on opening that up so that we can have a broad connection with people that are different than ourselves, because we have to grow that way. So social connection is really important. Mindset is critical. And I'm a big fan of tools like journaling, reading about mindset, listening to leaders in the mindset space. I have both a personal coach as well as a business coach, which really helps me to broaden my mindset. I'm always interested in having conversations around mindset. If you don't have that mindset of growth, the mindset around your values and what you value, and having the integrity around those things, then again, we kind of just like fall apart. We need to continue to focus on the things that are important to us, and mindset can help us to get there. And then the third of this section, or the 6th overall, is spiritual health. I want to be specific to a specific religion. I don't want to just serve Christians. There are lots of people that are in our program that are religious, and that's great, and of different religions. And I think there's a lot of value in that. I'm not going to say that any religion is right, because I think that overall, it's a spiritual health issue when it comes to HealthSpan. I think that also it can be done secular. You don't necessarily need to believe in the human created religions to understand that there is a bigger picture, a broader message, some kind of power that is greater than us, that is helping us to understand what our mission is, what our purpose is, what our soul is here on this planet to do. Understanding that can help you to have the right mindset to then help with the social connection, and then it all filters downstream from there. So I find that people that don't have an understanding of their spiritual health, that are not on a spiritual journey, do not improve their health and other things as well as people who are. So whether that comes through religion, if it is, that's great. That's an avenue that I prefer and pursue. But there's other ways to do it, and you can certainly do it outside of religion. But there has to be a picture, in my opinion, of some kind of spiritual growth. You have to be on some kind of spiritual mission and have a passion for pursuing your own purpose and why your personal soul is here on this planet and experiencing this world. And so that's my perspective on how we as humans and how our souls are working through this really interesting space that we have all chosen to be a part of. So I think that's part of it, and it helps us to understand then how to build from there. So the next level up is supplementation. It seems weird to go from all these lifestyle things to me like, well, supplementation, it's just a supplement. But here's the thing. Once you have your nutrition dialed in, you have all the other pillars dialed in, then we have to figure out where the gaps are. And this is where biomarkers come in. So we are always measuring serum biomarkers, potentially functional testing. And then based off of those results, we're recommending supplement stacks that can either help fill in the gaps or to do things that we don't have biomarkers for. So there's so many different options from a supplement perspective, and certainly it can be overwhelming. And there's the value of working with somebody who's really good with supplements to understand, okay, you want to take 5, you want to take 10, you want to take 100, but what are the most impactful ones and where do you draw the line? Because if you just start reading the literature and you look at, you're on social media, you could be taking hundreds of supplements and nobody can absorb, tolerate, or do well on that many things. So we really have to be specific and aim for the things that are going to help us to optimize our specific goals, but then understanding what those goals are. All right, so the next level is hormone optimization. Now, we started out really doing a lot of optimization, not doing as much replacement, but now we do a lot of bioidentical hormones. Both men and women have really fallen into loving the space around the women's hormone replacement. And this is true for premenopause, peri, and postmenopausal women. And the reason why is because it is such an underserved space. Women are ignored. They're shamed when they have complaints that are specific around, especially around testosterone, but even around estrogen and progesterone as well. The subspecialties in medicine and the traditional medical model don't do a good job of catching these. And so I see women that they're so underserved and ignored when it comes to hormone optimization. So we certainly serve men as well, and testosterone optimization and replacement. There's supplements and other drugs and replacement. All those things are important for the right person. But for women, understanding that our premenopausal women, generally, we're seeing people come in, and because of our society and the pressures that's put on them, they have adrenal dysfunction, they have low testosterone, they have progesterone deficiencies because those are made not only in the ovaries, but in the adrenal glands. Therefore, they have estrogen imbalance, and it becomes this thing, or there's so many symptoms associated with that are ignored or treated with other drugs like SSRIs because you have depression. But a lot of times these are based off of this adrenal dysfunction, then thyroid dysfunction, but ultimately it comes down to hormone issues. And so for our premenopausal women, understanding what's happening from a hormone perspective, respecting the cycle, respecting the fluctuations from a monthly and weekly perspective, and then understanding how to treat that either with supplementation, lifestyle, or potentially with some kind of replacement is really key. When it comes to perimenopausal women, this is where the testosterone picture becomes really, really interesting. Most women don't know this. Most doctors don't know this. But testosterone, as I mentioned for men, is really ignored in women. Testosterone is the primary sex hormone in women. People think it's estrogen, and that kind of makes sense because we're told about estrogen. Estrogen is important, and it has a role with progesterone, and it definitely manipulates the cycle during the month. But testosterone is consistent. Testosterone is consistently 5 to 10 times higher in women at any point in her life than is estrogen. And yet, when we talk about hormone optimization, and definitely in the replacement space, we don't talk about testosterone. And that's because in women, testosterone has really been tucked away and not discussed, because in women, we only talk about testosterone if a woman complains of sexual dysfunction or the lack of sexual desire. And then maybe we'll have a discussion around, and I say we, not me, but doctors will have a discussion around testosterone only in that case, but this is a psychiatric diagnosis that really nobody wants to make, and there's no commercial product anyway. So this is like a crazy space where we really need to be respectful of the symptoms of deficiency of testosterone, which we know clearly what they are in men, and we see those same things in women, and yet we don't diagnose it, we don't talk about it in the traditional medical model, and we don't understand that testosterone is really critical for women. And if we can give them physiologic, not super physiologic through pellets, but physiologic testosterone back and balanced estrogen and balanced progesterone, then we can really make women feel better, relieve a lot of the things that would be treated with other drugs otherwise. So hormone optimization and replacement is critical. And when we start getting around the perimenopausal space, which is, sorry how I got here, in the perimenopausal space where estrogen potentially starts to drop or gets very unpredictable, so it's up, down, it makes progesterone and testosterone even that much more important to have stable and on board. And then in the postmenopausal space, replacement, if it's indicated, and having an appropriate risk-benefit conversation, and then replacing not only estrogen and progesterone at appropriate and physiologic doses, but also testosterone. So key. So hormone optimization is a huge part of what we do now, and getting it done right and responsibly and having that correct, in my opinion, risk-benefit conversation is really important and really hard to do in the traditional medical model. It's almost impossible. Anyway, I think that is a really, really important thing to consider. Peptides are a fun part of our practice, and peptides are, if you're not familiar with them, these really interesting molecules that live in the space between supplements and drugs. They are made, at least the ones I refer to and prescribe, are made in compounding pharmacies by prescription only, but they're not made by drug companies. They are not overseen by the FDA, so they're not quote unquote FDA approved for anything. That doesn't mean that they're not effective. They are more effective than over-the-counter supplements. That's why they are only available by prescription. They are highly scrutinized, and there's some interesting changes happening with the FDA right now, but they are still available and they can be used. There's several different classes of them. There's cognitive peptides, there's immune peptides. There are peptides that are in the muscle maintenance and potentially increasing muscle mass space. There are weight loss peptides. So there's a lot of different things that we could potentially leverage for people that are interested in this while we still have access and availability to them. So that's something that could potentially be layered on, but they're not the starting point. And this is true with hormones too. You shouldn't just use a peptide or a hormone and think that you're going to optimize your health, because you're going to be missing the big picture. And then lastly, pharmaceuticals. So pharmaceuticals are these interesting molecules, right? That's why drug companies have pursued them, spent millions of dollars to make them available for people. There is potentially value in a pharmaceutical, but our industry, our medical industry, has flipped our pyramid upside down, not intentionally, but they've flipped the pyramid upside down and are focusing on pharmaceuticals because you can do it quickly and they are powerful, but you're again missing the big picture. And so I left the traditional medical model because I didn't like using drugs and surgery as the primary tool, when so many things can be eliminated if you start, again, flip that pyramid upside down. The way that we have it, start with the pillars of health and then work your way up. Then you don't need the drugs and you don't need the surgery, hopefully, but they exist. And there are some drugs that we do use. There's some really cool things. I just did a podcast on PDE5 inhibitors like Cialis and Tadalafil. These drugs, Viagra and Cialis, there is value from a blood flow perspective, both women and men. And yes, they're used for erectile function and sexual health support, but there's value outside of that: dementia prevention, performance, et cetera, true for both men and women. So there are a lot of potential drugs that we can leverage. And again, adding them in appropriately and responsibly is a really cool way to optimize health overall. So that is the health optimization pyramid. Super fun to implement this for people, to do it in an appropriate way, not overloading on supplements or hormones, measuring biomarkers, helping people to recognize that they can continue to aim for optimal, not average, and understand that we are made for greatness. We should be able to perform better than the current cultural and societal expectations would have us derive. Thank you so much for your time. And remember that we are made for greatness. So aim for optimal, not average. Don't be afraid to be extraordinary, because that's what it takes. If you haven't already, please click that subscribe button or leave us a 5-star review. It helps us to get this information in front of more people. And if you haven't joined our HealthSpan Nation, I strongly encourage you to join our HealthSpan Nation. It is a low-cost way to get into our ecosystem, to ask us questions about HealthSpan and potentially bone health, if that's something you're interested in. Access to our community where people are elevating each other up and getting into a space of like-minded people who are optimizing their health. Also gives you access to discount codes for our affiliate products and services. So I hope that all makes sense. Thank you so much for your time. I'll see you in the next video.
This presentation is for general informational purposes only, does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this presentation are at the user's own risk. The content in this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.